Alright, let's dive into something that might sound niche, but is actually a game changer for millions of kids. A new study on silver diamine fluoride, SDF, for treating severe tooth decay in young children. Now, before you think, why should I care about this? Let me tell you, this isn't just about teeth. It's about access to care, reducing pain, and preventing long-term health issues for kids who often get overlooked. So, buckle up, because this is way more fascinating than it sounds. Here's the hook. Imagine a treatment so simple, it's just a liquid applied to a tooth, yet it could replace invasive procedures that require general anesthesia. Sounds too good to be true, right? Well, this study, published in JAMA Pediatrics, suggests it's not. But here's where it gets interesting. While the results are promising, they're not a silver bullet. And that's exactly why this conversation matters. First, let's set the stage. Tooth decay, or caries, is ridiculously common. Nearly 50% of preschoolers worldwide deal with it. In the US, it's 40% of kids aged 2 to 19. Left untreated, it's not just about cavities. It's about pain, infections, and even issues with eating and speaking. For severe cases, especially in young kids, treatment often means multiple trips to the dentist, sometimes under general anesthesia. That's expensive, risky, and just plain scary for a toddler. Enter SDF, a cheap, non-invasive solution that's been gaining traction. But here's the catch. While it's been used in other countries, its effectiveness in US populations, especially kids under 3, has been unclear. Until now. This trial, involving 830 kids aged 12 to 71 months, found that SDF arrested tooth decay in about 50 to 57% of cases over 8 months. That's compared to just 17 to 22% in the placebo group. Personally, I think that's huge. But what's even more intriguing is the nuance. For instance, the study didn't find that a second application of SDF at 6 months improved results. Does that mean one dose is enough? Or is it just not as effective as we hoped? This raises a deeper question. Are we expecting too much from SDF, or are we not using it optimally? One thing that immediately stands out is the variability in results. Front teeth responded better than back teeth, and more advanced lesions had higher arrest rates. What this really suggests is that dental anatomy and hygiene access play a massive role. If you take a step back and think about it, this isn't just about the treatment. It's about how we approach oral health in kids. Are we doing enough to educate parents and caregivers about brushing habits? Or are we relying too heavily on quick fixes? Another detail I find fascinating is the placebo group. About 20% of their lesions arrested on their own. What many people don't realize is that tooth decay can sometimes resolve without intervention, especially if hygiene improves. This isn't to say SDF isn't valuable. It clearly is, but it's a reminder that no treatment works in a vacuum. Context matters. Now, let's talk about the elephant in the room, side effects. Nearly half the kids in the SDF group experienced adverse events, though most were mild. For kids had severe reactions, but the study doesn't confirm SDF was the cause. From my perspective, this is where the conversation gets tricky. On one hand, SDF is safer than general anesthesia. On the other, we can't ignore the risks, especially for a treatment that's often used in underserved communities where follow-up care might be limited. This brings me to a broader point. SDF isn't a standalone solution. The researchers themselves say it should be part of a larger preventive strategy. And that's where I think the real opportunity lies. If we combine SDF with better access to dental care, education, and policies that prioritize kids' oral health, we could make a massive difference. But if we treat it as a magic bullet, we're missing the bigger picture. So what's the takeaway? Personally, I think SDF is a huge step forward, especially for kids who can't access traditional dental care. But it's not perfect, and it's not enough on its own. What makes this really interesting is how it forces us to rethink oral health as a systemic issue, not just a dental one. If we're serious about helping kids, we need to look beyond treatments and focus on prevention, equity, and education. Here's my final thought. What if this study isn't just about SDF? What if it's a wake-up call to address the root causes of tooth decay in kids? That's the question I'll leave you with. Let me know what you think in the comments. Is SDF a game changer, or just another Band-Aid? Let's keep the conversation going.